From the Toronto Star, I'm Reggie Mudler, and this matters. Operation Warp Speed is the name for the U.S. program to speed up development of a vaccine, which, along with the concentrated efforts of the global scientific community, has seen creation of possible vaccines in a very short time. As COVID-19 continues to spread all around us, and as the numbers seem to grow ever higher, there are some experts who believe that rapid testing could fill in some of the gaps as we wait for those vaccines to arrive. The truth is that Canada just doesn't seem quick on the uptake of these tools, at least not yet. The federal government has purchased 38 million rapid tests, and while they are rolling them out to the provinces, they've only seen limited use, and some provinces are just stockpiling them. This is a fast-moving virus, and so are the scientific efforts to control it. But so far, at least in this country, rapid testing is being rolled out at a slow pace. Jacques Gallant is a Star reporter who has been covering what's been going on with rapid testing, and tells us, if you are hoping to get your hands on one, you shouldn't hold your breath. Jacques, thanks so much for joining us today.
Well, thank you for having me.
So there's obviously a lot of talk about vaccines and a lot of hopes in that basket, but I think in the interim, rapid testing could fill in some of the gaps and maybe help us get back to normal. What are experts saying that they could be used for?
Yeah, certainly the hope among some experts is that ultimately rapid testing, especially at-home rapid testing, which we do not have in Canada right now, could help alleviate some of the pressure because it could potentially help detect more cases early and therefore break the potential chains of transmission earlier. So that's kind of the hope, that it would catch more cases earlier, rapid at-home testing, which we don't have in Canada right now. What we do have is a few rapid tests. There are a few of them that have been authorized by Health Canada, and the federal government started shipping them out to the provinces in the last 2 months. And those tests are rapid, but they still need to be administered by healthcare professionals to the individual. They can't be done at home. And they are generally of a lower sensitivity than the gold standard PCR test, which is done in a laboratory. So those rapid tests that are being used right now in some of the provinces, some experts say they are helpful in catching, especially asymptomatic individuals, people who would not have gotten a test otherwise because they don't have symptoms. But experts say the rapid test allows for those people to be caught up, and then the result can be validated by a lab-based test. So it helps in that regard, especially the rapid tests that are being used right now. It helps in catching people who are asymptomatic who wouldn't have gotten tested otherwise.
I want to talk a little bit about that reliability, because it seems to be that this might be one of those situations where we're sort of letting the perfect get in the way of the good. Let's talk about these reliabilities. So the gold standard obviously is the PCR test. You can have this in the lab. The rapid tests, obviously they're fast. They're just not as reliable. How reliable are they? And can you tell us about the tests that are available here and how well they work?
So the two most commonly used rapid tests right now in Canada are the Abbott ID Now and the Abbott PanBio. And the company has defended both of them by saying that, they're highly sensitive, and sensitivity is the ability of the test to produce a positive result, to detect a positive result of the virus. And both of them have a sensitivity in the 95% range, in the high 90s, according to the company. Now, other experts will say, though, that the data that's often given by companies that produce these tests, the data tends to be higher than data where the tests have been used in the community. So it's like they often caution that the data that we get from companies is higher because these tests have been tested in laboratories, they've been tested in clinical settings, but they often differ than the data from when the tests are used in the real world. Like Alberta Health Services, in a story that we ran over the weekend with my colleague Kieran Levitt, we have an analysis done by Alberta Health Services included in the story where they analyze the current literature on rapid testing. And they do say that generally the literature shows that the sensitivity for both of these tests is in fact lower than the data that the company is giving. And the data that's lower is data from when the tests are being used in a variety of settings. I hope that makes sense. It's like the data that we're getting from the company, they always do tend to be higher.
Probably a little bit more optimistic.
Mm-hmm. Mm-hmm. Absolutely.
So, where are rapid tests being used in Canada right now?
So the federal government has started shipping them out to all of the provinces, at least going back to October. Most of the provinces did respond to us for our story that ran over the weekend, and most of the provinces either do have them or are getting them. But the usage of these rapid tests is really varied across the country. So, for example, Prince Edward Island says that they're going to be getting 10,000 rapid tests from the federal government, but they said they didn't ask for them, that they're quite happy for now with the performance and turnaround time of the lab-based PCR test. So they plan to put those tests in storage for the time being. They've got no plans to use them. Compare that to Ontario, for example, where last week the Premier and other government officials announced that they'll be using them in a variety of settings. They'll be using them in hospitals, assessment centers. They'll be using them to screen visitors and staff in long-term care homes. They've partnered with a number of various industries and private workplaces to pilot a project where the rapid test will be used to screen workers. And then in Quebec, they've said that they're not really using them right now either. They've decided to set up an expert committee to study the use of these tests further, as well as to use them in a few pilot projects, mainly involving hospitals and university researchers. And then maybe by the end of the year, the plan is that they would roll them out in certain settings, including schools, long-term care homes, remote regions. So you can see that, like, some of the provinces aren't using them at all right now. Some are using them full throttle, and others just haven't even gotten them yet. It very much varies across the country.
Isn't that a bit weird? It's one of these things that it seems to me as the numbers are sort of flying through the roof. I mean, I understand, like, if we're asymptomatic, we're not supposed to go have tests at the hospital right now because obviously you do not want to flood them even more than they are. So what's the holdup here?
Well, I remember as one epidemiologist put it to me in our story, it's that ultimately it's the provinces that shoulder the burden here, and they have to own the consequences of potentially inaccurate results. They're concerned that there could be inaccurate results from some of these tests. Like, the provinces have decided to take a cautious approach because ultimately they own the consequences of this. So even though Health Canada has authorized the use of these tests, they are generally less accurate than the lab-based PCR test. So each province has obviously adopted a fairly cautious approach in using them because at the end of the day, they own the consequences of this. So for the most part, as one expert said in our story, they really ought to hurry up, but they can understand the logic behind most of the provinces taking a slow and cautious approach and using them. They want to test these tests themselves. They want to see how they work in a variety of settings before they actually expand their use. So, I mean, if all goes according to plan, in Quebec, for example, maybe we will start seeing them used more frequently in more settings by the end of the year. But certainly right now, in most of the provinces, they are not being all that widely used.
We'll be right back. You guys mentioned Nova Scotia in your piece, and how they're using it in sort of pop-up uses, but also sort of late night, post-bars. Everybody's been blaming young people for going out. This, I think, could be a very good idea.
It is a fascinating idea. Yeah, it's very clever, as another expert put it to me in our story. A lot of Nova Scotia's recent positive COVID-19 cases have been people aged 18 to 35, and a lot of them had been kind of traced back to evenings out in bars and restaurants in the last 2 weeks or so. So yeah, Nova Scotia has so far received about 67,000 of the PanBio rapid tests, and they say more are on the way. And for now, that's what they started using them for. They set up these pop-up site in Halifax and encouraged people who had been in bars and restaurants in the last 2 weeks to come in and get tested. And like, as one infectious diseases expert at Dalhousie in Halifax said to me, and she was also out at the pop-up site, she said, yes, these tests are less sensitive than the PCR test, and yes, we might even miss some positives, but it's really important to remember that the people that we're testing right now, 100% of them would never have gotten tested at all otherwise because they're not symptomatic. They were highly unlikely to go wait in line for a lab-based test because they're not symptomatic. And so they were able to catch a few cases that way. And if they did test positive with the rapid test, they would then, of course, get it validated by also having the person take a lab-based PCR test. So that's what they've started doing in Halifax. And apparently, from what I've heard, it's been going very well. And they do seem to be happy with it so far with that project.
Well, Jacques, I'm not going anywhere, but I miss bars. So if it gives me a bit of hope once we return, I will take that.
Yeah, take any hope you can get from this.
Exactly. We probably should have talked about this before. Are these tests exactly the same? Like, is this a thing that they jab way up my nose? And how rapid are we talking in terms of results?
Rapid, yeah. Like in some cases, it can be as little as usually like 15 to 30 minutes in that range. And it is still like a nasal swab. You can't do it yourself. You still need to go and get a trained professional to stick it up your nose. Yes. But they are rapid versus a lab-based PCR test where they take the sample and they have to send it to a lab. And depending on your province, like depending how fast the labs in your province are working, it can be anywhere from, I think, some provinces have 24-hour turnarounds, but it can be up to 72 hours.
Okay. You mentioned earlier, and the other important part of this piece, this is the idea of rapid testing at home, which from your piece, it sounds like there's a bunch of companies working on this. A bunch of people have talked to Health Canada, but there's just not available here. What's going on with those?
At-home testing is a really interesting part of this wider discussion on rapid testing, because some public health experts have said that is absolutely what we need is rapid at-home testing. And the federal Conservatives have certainly been hammering the government on this too, saying this is what we need, like we should have had it long ago, et cetera. But the reality on the ground in Canada is that at least as of last week, when my story ran, Health Canada had still not received any applications from anyone for the authorization to use a rapid at-home testing device. And Health Canada says that they've been proactively reaching out to companies going back months now, encouraging them to apply, but so far no one has applied. And it's also important to remember, though, that like if you look at the United States as just one example, the US only got its first rapid at-home test less than 2 weeks ago. The first rapid at-home test in the US got emergency authorization from the FDA less than 2 weeks ago in mid-November. And it's called the Lysura all-in-one test kit. And I spoke to the company and they said that they were singularly focused on getting FDA approval. And now that they've got it, they're going to ramp up production. So they have no plans to expand into Canada anytime soon. And I should mention that they are one of the companies that Health Canada had proactively reached out to. They have no plans, though, to expand into Canada. But that test that they're going to be ramping up production for now that they got emergency authorization, it is a rapid at-home test, but it's a single-use device, and it's $50 US a pop, at least for now. That's what it retails to. And for now, it's going to only be available in very limited supply in certain doctors' offices, for example, where they can prescribe them to the patient to use at home. It's important to remember that there's no widespread rapid at-home testing happening in the United States right now, and likely won't anytime in the near future. So it's not that we're extremely behind in Canada in that regard, at least when comparing with the United States. So that's where we're at in Canada, though, is that no company has applied for authorization for rapid at-home testing in Canada, despite Health Canada saying it's been putting in its best efforts to try to get people to apply. But that's where it stands.
And to be clear, one of the differences with the at-home tests is it's usually they're saliva-based, right?
Some of them can be saliva-based, yeah. Some of them can be still nasal mucus-based as well, but yeah, some of them are saliva-based. The idea is, as one doctor in Vancouver put it to me, she's a big proponent of developing and widespread use of rapid at-home tests, is that it would be basically like a pregnancy test, except instead of urine, it's mucus or saliva. And you would do it every morning, and you would know maybe within 15 minutes or less whether you're COVID-19 positive or not. And then you could make decisions based on that about how you're going to go about and live your life for the next few weeks. But it's important to also remember, as another public health expert put it to us in our story, is that sounds great, certainly, that people would be able to test themselves almost daily and that it would be cheap and relatively effective. But one concern with that is there'd be a possible lack of public health monitoring. So it's like a person tests themselves at home and it comes back as positive. how do you ensure that that person then quarantines themselves or makes the arrangements to go and get a lab-based PCR test to confirm the result, or calls up public health to report the result and initiate the contact tracing protocol? How do you monitor that? And I don't think we really know how you monitor that because we don't have it. This is all still so new. It's still in the initial stages. So it's like, how do you ensure that people would still follow the rules if they tested positive? We can't assume that everyone is going to do what they're supposed to do if they got a positive result when they were home alone.
Well, we've already seen that.
Yeah, yes. Yeah. I mean, we see what happens already. Exactly.
But okay, this is the thing. Okay, say these were easy to get. Say I could have a rapid at-home test. Say even I could go get one of the Abbott tests right now. How am I supposed to use them? This is the thing right now. I mean, obviously Christmas is the thing that everybody is worried about. Like, could I possibly go get one and then go visit my elderly parents?
Certainly not at the moment, no. I mean, you're in Ontario, so Ontario has made it very clear how they intend to use the rapid tests right now. Like, we're not at the point yet where you could potentially just walk into a pharmacy and get one or anything like that. And you can't do it yourself. It does have to be a trained professional administering it. And if you look at Ontario right now, they've made it clear where these tests, at least initially, are going to be used. It's not for widespread use yet. And I don't know if it ever will be, but it's certainly not right now.
Back to the Abbott tests. Again, this is the thing. I think you reported that the government's already bought 38 million of these tests. 5.5 million have been shipped out, I believe. But the plan is also to keep on buying a ton more of these over the next 2 years, right?
Yeah, the government has procured 38 million so far. Yeah, you're right. And 5.5 have gone out and more are on the way. And the plan is to continue procuring them this year and into next year. And actually, as my colleague Kieran reported on Friday, the government just got its shipment of a different rapid test that it ordered, and I just can't remember the name of it right now, but they got their first shipment and they plan to send those out to the province soon as well, another rapid test that they've signed on for. So yeah, no, the plan is absolutely to keep procuring these into 2021, and the provinces are still expecting shipments into 2021. So they are going to continue procuring them despite the hesitancy that we're seeing from some of the provinces right now. But I think it'll just be important to see and interesting to see by the end of the year what some of these provinces decide to do with them. Like, it's not like the provinces have said, don't give us any, we don't want them outright. They're just still being very hesitant in using them. But they are, in some provinces like Quebec and others, they are clearly testing them and trying to see where they can use them, and maybe ultimately will use them on a wider scale. It's just we're not there yet.
Jacques, you're bumming me out, man.
I know, I'm so sorry.
All I want for Christmas is a rapid test or a vaccine, dude.
I want a vaccine too. I want a vaccine right now. I know, it's depressing.
Jacques, this has been awesome for us. Is there anything that I didn't ask that you think that our listeners should know?
Oh, well, I'm going to sound like a total public health expert right now, which I'm absolutely not. But I would just remind people that testing is not the be-all, end-all. Access to rapid testing is not the sole silver bullet that is going to end this pandemic, and that it's really important that people remember to continue to wear their masks, continue to wash their hands, continue to physically distance, and to stay home if they're sick, and to self-isolate if they get a positive result, and that if they do get a positive result with a rapid test, to also get that validated with the lab-based PCR test as directed by public health authorities. So that's all important to remember, that it's a layered approach. It's not just rapid testing that we need. It's a layered approach in terms of fighting this pandemic and breaking the chains of transmission.
Jacques, that's excellent advice. I would really want to thank you for your time today.
Thanks again for having me. It's been great.
Jacques Gallant is a Star reporter who has been covering rapid testing. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Raju Mudler, Adrian Chung, and Saba Etisaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Foso. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.